We are talking to Dr. Gorgia Balsley from Michigan, and she has been a naturopathic physician for over 30 years. And we're going to talk to her about Somaderm and why she's so excited about it. For all the people that are listening, I think what we want to talk about is, can you help everyone listening, and myself included, to really understand when people talk about homeopathic medicine, Gorgia, working on a frequency basis, that, you know, we're microdosing into the body. And I think some people wonder, how can this really help? You know, it's coming in so minimally. How can it really go through the blood barrier, and how does it get into the system? And, you know, these are the questions I think that everybody has on their mind, because it's you know, it takes some study, right, to really understand that. Could you speak to that about homeopathic meds, and especially this transdermal?
Absolutely, absolutely. And it's a very unique way of delivery system. However, I love homeopathy because it's very targeted. And I use that within my practice. It's one of the modalities I use. And homeopathy has been around for well over 200 years. And the founder, really, of homeopathy is Samuel Hahnemann back in the 1700s. And homeopathy is known as the law of similars. And so Hahnemann, he realized the benefit of minimal dose. And we see that with actually drugs or various different things that we use. If you take too much, you have all these side effects. And he found that through testing, when he gave a set amount, they would have these side effects. And his thought was, if I minimalize it, what would happen? And he found it to be even greater with less side effects. And so then he realized the benefit of what was called minimum dose. He found that a dilution and potentization would achieve the maximum benefits with the least amount, if any, side effects. And so you see that in this product, because when you look at the back of the label, you see the HGH is at 30x. You see the thyroidinum, that is at 8x. And then you see the supravenalis suisse, that's the adrenal support, at 6x. And really what those numbers mean is you take HGH, and that is 10 to the 30th power. So when you do that equation, you realize that is so tiny. So the question is how can that product, the HGH that's so tiny, create a maximum benefit? Well, when it gets into the body, it the higher the potency, the deeper acting and stimulating that homeopathic becomes. So that's why you see the HGH at 30x and you don't see it at 6 or 8x. And mainly what's exciting about that is because when we talk about human growth hormone, and by the time we're about 25 it starts plummeting, we really need that stimulation and that help by the time I'm 55. Most of our users are, anywhere from, let's say, 28 on up. I've seen testimonials
into their 80s.
70s and 80s. Yeah. And so the need is so great, and so we're getting the maximum amount of stimulation without overstimulation. And because it's microdosing, this is the beauty, is that it causes our body to raise our own HGH level, where people will get online and start looking at HGH and, I see it associated with the risks of, cancer and cell proliferation, all these. That is because it's coming from a high dose source. When I say high dose, you're getting an injection of a large amount of hormone at one time, and it creates overstimulation in the body, whereas a homeopathic will not. That's the beauty of the Alex bringing it as a homeopathic platform. So it's not you injecting a synthetic into your body and it's doing the work for you. It's stimulating your own body to do the work for you. Therefore, you don't have the side effects. You don't have to worry about the risks that come with an injection. So when you look at the thyroidinum at 8x and the adrenal support at 6x, those are potencies that were designed to balance those glands. And, as we age, and we're seeing it more and more, I see it in my practice, younger people, younger patients that come in adrenal fatigue, because we feel, that whole I want to live it hot and I want to live it now, and I'm going to slide into home base and even with my hair on fire. And so we're burning the candle at both ends, and it's causing stress on those organs. Therefore, you see thyroid issues, you see chronic fatigue. Along with that, you start seeing other issues that come along because those glands are stressed and not balanced as well as they should be. And so I think when I saw this product and it was presented to me, I'm a product guru as far as ingredients, and I went through everything. The thing that caught my attention immediately was the fact that it was homeopathic. And I was just on cloud nine. And then I went through the product and I went, this is a product that can balance that HPA axis, the hypothalamus, the pituitary, the adrenal axis. In my world, it's hard to do that, and it takes several products to do that. And it's all combined in one product. That was very exciting for me. And the fact that I don't have to communicate to my patients that all these pills that they have to take, they just can rub it on. And how much easier is that? And so when we talk about using the homeopathic and then using it in a transdermal gel, if you take a homeopathic and you take it orally, there is a reason of the way you have to take it. So there's a protocol for taking it. So when you use a homeopathic, homeopathics are very, very sensitive to oils, to mints, garlics, onions, coffee, foods. And so
even saliva, right?
I'm sorry?
Even saliva, homeopathic.
Even saliva. And there's a lot of variable changes in the mouth. And so you can negate the effect of it by using it orally. Here in a transdermal, you don't have to worry about that. And then by rubbing it in the tender areas of the wrist, the forearm, the inside of the upper arm, inside of thigh, behind the knee, those are areas that are normally not exposed to daylight. So, they're not tougher tissues, and they easily absorb in there. And you have a lot of blood vessels and capillaries, and so it absorbs, takes it right into the bloodstream, and is activated. So we don't have to worry about the fact that you ate garlic or that you brushed your teeth, those type of things. That issue is totally taken away, and you don't have to worry about a consumer using it and forgot to do those things, because then it seems like a lot of work. Alex made it extremely simple. And when I saw that, I realized this is an amazing product, and I need to get involved with it, not even for the financial end, but what it could do for my patients. And offering something that is extremely targeted, that definitely works. I use the product. My husband uses the product. We have great benefit. One of the things that has totally blown my mind is in 2000, I got very ill on my own, and I was diagnosed with celiac disease. And it did blow my mind, but they think I possibly have had it for years. Well, one of the things that got me was I lost my hair. I had an amazing head of hair. It was very long, almost to my ankles, lots of hair, and it started coming out in the shower, and it became so thin and unhealthy that I was balded on top, and I literally cried. It was what woman wants to go bald. And I thought, Lord, I can grow nails. Why can't I grow hair? And in our world, it's very hard. We see a lot of women, men as well, that come in and they start having hormonal shifts and things in the hair. And I can't even begin to tell you how many practitioners that I have talked with, and, what are you doing for hair? And almost everyone says, that's a really hard one. Are you taking biotin? Yeah, I'm taking lots of biotin. It's not doing anything. And, it's a multidimensional issue when it comes to hair. Well, for me, I started using the product not even thinking about my hair. I was thinking about the benefit of I sleep well, but to have better sleep, to have better focus, to have a little bit more definition at my age. Who wouldn't want that?
Right, a little weight loss, sure, all that.
Yes. The cream to the whole thing, almost the icing on the cake, is my hair has grown, and it's grown over 4 inches.
It's crazy. I know you posted that.
I have lots of new growth, and I am just ecstatic for that reason alone, I will continue using the gel. I've years, and I have done everything to try to get my hair to grow, and it's done that. So when I look
now,
at
do you believe that homeopathy? I'm sorry, I stepped on you. I as you're talking, I'm so excited to listen to you that and I'm terrible at my mind is reeling with so many questions, but I've learned from a friend of mine who's a homeopath that homeopathic drugs will find what the body needs and they will go there. Just like she said, it's like a car that gets in and it's traveling down the road and it's going to find its friend. And she said that's exactly what homeopathy will do. You know, it'll see what the body needs the most of. And you're talking about your hair, and I've read you talk about that on the testimonial page. And for me, I hadn't, and this is my testimony, I hadn't slept more than 4 hours uninterrupted in probably about 7 or 8 years. And so, you know, third night in, for me, it was the sleep. Do you see how that happens? Has that been your experience with homeopathy, that the whatever the remedy is, that it does go into the body and search out what that person needs?
Absolutely. Absolutely. And so, you know, when we, you know, on the page, we also see, you know, when we talk about the hair, we're seeing a lot of women, men included, that are talking about the thyroid and if this product will help the thyroid. You know, when we go to the hairdresser, you know, that's one of the things, if you start having thinning hair, they'll say, have you had your thyroid checked? And, you know, and I have. And, but, you know, having that 8X thyroidinum and the adrenal support, in my world, in all the years of doing naturopathic medicine, in Chinese medicine, I use the basis of Chinese medicine. We are taught that the thyroid and adrenal go hand in hand. And if you address one, you have to address the other. And that is the beauty of this product. He put that in there. So you've got the thyroid support, and he balanced it with the adrenal support. And then you have the human growth hormone in there that also helps with the regeneration and the balancing. So it's a great combination that he put together to see huge results, not just one. So, you know, if somebody didn't have the hair issue, my husband has a full head of hair, but for him, his hair grows all the time, but we're noticing color change. You know, for another person, you know, the bones, the strength of the bones, the sleep. And sleep is so imperative. And that is the one thing we see resonating in the testimonies is sleep, sleep, sleep. We cannot heal if we do not sleep.
Right. So I mean, it's a category changer for you, really, this product. I mean, I feel like we've talked a lot about that, you know, in the field, that this is a category changer. But as I listen to you, with years of experience under your belt and dealing with so many people, your patients with so many varied problems, because, you know, I'm sure you're a lot like my naturopath that I use. And when I come in, I lay out everything to her. You know, like there's nothing that I don't tell her, ache or pain or interior stuff or even, you know, mental stuff, you know, anxiety like we're talking about to address the adrenals. She takes every single thing that's going wrong with me, quote unquote, you know, and has to deal with it. Where when we go see our doc, we often feel under the gun, that they maybe don't have enough time for us, you know, and then we want to talk about another issue and our time's expired or it's not their specialty and then we have to go see someone else. You must feel like this is a category changer for you to have the Somaderm at your disposal, because it feels like what you're telling us is there's almost no one over 25 that you would see that might not need this for one reason or another.
Absolutely. Absolutely. You know, you've got products in there that balance the adrenals, will help with anxiety. When you balance the adrenals and thyroid, you're going to see a shift.
I raise my hand, yes. I'm a panic attack sufferer for many, many years, and I never anticipated that as a benefit. It's brought me to tears, you know, the renewed sense of just passion for life. And when I feel the anxiety come up, and maybe people listening are nodding their head in agreement, it just kind of tamps down. It hasn't gone away, you know what I mean? But where it would come up and rise and keep rising, it just goes back down. And I find that same thing, Gorgia, with anger or things that would, you know, I'd be quick to like, oh, this is getting me so crazy. It just kind of comes up and then it goes back down, and you can't underestimate what that means for us as a population, to be able to feel like our anxiety and depression and, that this overwhelming sadness a lot of people feel is just sort of maintaining and lifting itself up. That's remarkable to me.
Absolutely. And Patty, last Monday I was in a functional medicine meeting with several other functional medicine doctors, and they were talking about different health crises, and one of the ones that they brought up was Lyme, and they were using a specific product and HGH injections for Lyme patients, and that caught my attention. And I'm like, is that right? And why are you doing that? Well, because we see in Lyme an excitatory phase with the adrenals, and we know that if we use this combination, that our patients get the utmost help. And of course, I'm using this product, and my mind is just churning, and it wasn't the place to be able to talk about it, but I went around and took all their business cards, because I thought, if you're using injectable HGH, knowing, and what they're probably doing is they're looking at the benefit outweighing the risk. I get that. But this gives a whole different opportunity to be able to provide a much safer alternative for those patients that they're serving. And I'd never heard that before. I made a mental note. Very, very interesting, and especially when they explained why, because of that. They're in that fright and flight because of the condition, which turns on the adrenals, and they're trying to calm all that down, and they're using human growth hormone for that.
That's amazing. I mean, I live in one of the, Connecticut is rough, obviously, named after Lyme, Connecticut, old Lyme, Connecticut, right? It's pretty rough out here, and you almost feel like people in New England go into a fear state at this time of year, especially, when we have to do everything.
I'm sorry, I just need to interrupt. I am actually a Lyme patient, and I have been using this gel, and I do cry because it's changed my life. So yes, it helps with Lyme. I'll mute myself after again.
Thank you for weighing in.
No,
you were jumping through the phone lines. Thank you for weighing in. I mean, it's an epidemic, and obviously prevention is our best ally, of course, with the ticks, but that's hard, and so even to know that there are people that could be, suffering from reoccurring, or whether it's ehrlichitis or anything like that, that's phenomenal that you're sharing that with us. I wanted
Patty, to have this product and also have it FDA registered is super huge. That never happened.
Tell us what that means to you, and also the national drug code number, Dr. Gorgia. What does that mean to you?
Well, it's another form of being able to have checks and balances. So, people need to understand that you just can't jump in and decide, I'm going to get XYZ registered with the FDA. It's going to be a great product. We'll just do that. They have to first, because this is a homeopathic product, it has to meet the HPUS requirements, which is the Homeopathic Pharmacopoeia of the United States. And it has to meet their guidelines in order for it to be registered. So, there's several different parts of that guideline. One is that it's got to be safe and effective. Two, it must be prepared according to specific general pharmacy and relevant sections of the HPUS. There must be submitted documentation, and it must be approved in a format set forth by HPUS. The therapeutic use of a new, what they call, anything that's put forward, even a homeopathic, is considered a new drug in their eye. So even though it's not a drug, in their whole language that they use that. But the therapeutic use of a non-official homeopathic drug, they must have proving and clinical verification acceptable to HPCS, which is the criteria. So we have a lot of people like, what is the research on this? And there is. He had to submit it in order to be able to get registration. And there must be a therapeutic use established through published documentation. And the therapeutic use is established by at least 2 double-blind clinical studies. And then the therapeutic use is established by data gathered from clinical experience encompassing the symptom picture of pre and post use. And that's kind of in a layman terms that people can go on and look at the HPUS and what the criteria is so that they can have an understanding that this gentleman, Alex Goldstein, didn't just put a label on a bottle and put it on the shelf. It had to go through specific requirements in order to get that registration. And to have that, and there has never been, to my knowledge, a homeopathic that's ever been registered with the FDA. That's huge. And so when we're talking to people, we can feel good about not only what the benefits are, but knowing that there was a lot of research and data that was put forth to be able to put this product in a registration mode. So if we're looking for some kind of safety factor, there it is.
And the National Drug Code. What do you use that much in naturopathic medicine?
No, we don't. No, we don't. But that's huge. And when we're talking, the biggest thing is in the United States, homeopathy is not, and you can understand this, is really not the wide accepted percentage of people would go seek that out.
Not like Europe.
We're medical based.
No.
Yeah,
right.
But Europe is what, 45%, I believe.
Oh, they love it. They love their homeopathy and their naturopathic docs. Yeah.
Yes. And so this was the basis of medicine way back in the day, and then we've gone over into the westernized medicine, and it's never gone away. It's made its reemergence because we're seeing that people are starting to wake up and take more accountability for their health care, and they're not wanting to use a bunch of drugs. They're not wanting to use this drug and then have to take another drug to negate the side effects of this drug, and then another one and another one. They're saying, okay, I need to be responsible for what I'm doing and what I'm putting on my body, and how can I better my health, especially with the cost of insurance now. They're looking for ways to beat the age man that's coming after us, because every year we're getting older, and they're looking at ways to save on money and keep active and healthy long term. So people are starting to see more and more of that, and to bring that in this setting, I just think that it educates more people what's available to them as an option in their own health care.
Well, I think we're turning back the hands of time a little bit with our outlook on our health, which is phenomenal. When I tell people I'm in the holistic healing arts, they, that new age stuff, and I say, it's more archaic revival than it is new age anything, because my grandmother used to put a mustard pack on our chest when we come down with something, and she'd use cinnamon. The list was so long. Coming from Italy, she had her whole list of things. She'd make a broth with garlic and turmeric, and turning back to those things like you're suggesting and getting away from so many RX meds, or running to, a handful of Tylenol or a couple of Aleve, or, just the things that we've become accustomed to, that kind of microwave mindset, right? We want our healing in like a half hour. And I think that's the balance that I do feel, some people are frustrated by, because they kind of think that within 24 hours, they're going to find a response, or by the second night they should be sleeping, 10 hours without getting up. But it is that delicate piece of homeopathy, right, that makes it so intense as the benefits start to show themselves. And I almost have to look in the mirror, Gorgia, every day, and I'm sure you're sharing that too with you and your husband, that, there's subtle changes with homeopathy, right, that with Western meds, we kind of feel like the doctor's going to ask us in a day or 8 hours even, are you feeling better? That should have kicked in by now, But I look in the mirror every day, or I'll look down and notice, these spider veins are gone, or, another dark spot has disappeared, or I actually, I'm going to say this out loud for the first time, I'm pretty sure my teeth are whiter. And I'm not I'm not a girl that puts the strips. I do like a charcoal wash in my mouth every once in a while, but all of a sudden I'm taking like pictures for my work, and I go, my teeth are whiter. So it's like things like that I feel that when people look at homeopathy, and all that you've gone over with us tonight. You know, it's just this delicate frequency that as it works with the body, and I so appreciate you explaining it to us, because my takeaway from listening to you more than anything is the power of this product. And I feel like getting on this call, I really know the power of the product, but I feel like that times 10 right now after listening to you. We really should be telling everybody, right? There isn't really a group of people except the under 25s that really don't want to know about this. Is there any reason why, say you were 28 or 30 or so, and you're not having a good time sleeping, you've got young kids at home or a million different things, you're working 2 jobs, is there any reason why a younger person wouldn't want to use the product?
I would not have I have no understanding why they wouldn't want to use it.
Okay.
Because it's just absolutely beneficial. And the longer that we can, the more we sleep, as you know, we recuperate. You get to fill your cup up. You're more energized. You're more focused. The deeper sleep is another thing is because, when you get into that real deep recuperative sleep, you're in REM and you can heal. But then, a lot of people are using melatonin to sleep and it's not working. And that is also a hormone, which is funny because people will go to melatonin and have no problem taking it and then question up and down about the gel.
Right.
But in the darkness, because you're sleeping and you're sleeping so deep, you're enhancing your own melatonin production, which is phenomenal.
Is that why we dream more vividly when using this product?
Yes.
Because our own melatonin production is enhanced.
Yes.
Because a few people have suggested to me that this could be a placebo effect. Well, I am a student of the gel and homeopathy for many years, so I knew that it didn't have a placebo effect. But what someone said to me was, a dear friend of mine who is a homeopathic doc said that the science behind the fact that someone is having vivid dreams should let them know that has nothing to do with a placebo. A placebo effect would never cause the brain to have a vivid dream. And so if you're waking up going, oh my God, you can't believe what just happened in my dreams, she said that should prove to them that the product is working. Would you agree with that?
Absolutely. I'm 100% agreement with that.
Awesome. So Dr. Gorgia, the one last thing right before we let everybody off, and I know everybody's probably like, they'd be happy to listen to this call for a good another half hour. We'll invite you back if you'd be willing to come back with Kenny and me on another Wednesday night call. But a couple people have texted me since we've been speaking, and you touched on how this product, the Somaderm gel, can help with thyroid health and how thyroid relates to the adrenal glands also. What if someone has had to have their thyroid removed from a cancer or another disease? Complicate this for them at all, or do you feel from your gut as a naturopathic physician that they get the green light?
I would give them the green light. And the reason being is now the thyroid is missing. They're using thyroid hormone in its place. The adrenals are now more taxed, and they could use this. If anybody could use this product, they could.
Awesome. Especially them, it sounds like, right?
Yes.
Because they're missing that, so we have to make up for it. And I love the whole thing about how you touched on the gel. My mom is going to be 86 in a couple months, and she has a hard time swallowing her vitamins. And she got so excited when I told her that it was, a transdermal application. And I've talked to a lot of other people now that say, especially in the elder community, that's a beautiful thing. Not, again, having to ask someone to swallow something, right? And the fact that in the elder community, the skin is so thin, I've touched on that on a couple of calls, that it seems to show a great benefit very rapidly with people. The older they are, I said to my mom, put it where the skin is thin, and she started laughing, and she said, okay, that's pretty much 95% of my body now, where I could rub it anywhere I want. But, the response is just so quick, the thinner the skin. But I love that application, and I'm sure just, again, I keep saying I'm promising that we're going to hang up, but I'm sure that you love a lot of the secondary ingredients too, right, Gorgia?
Yes. I think
that go in.
Yes. And They're minor, and I did go through them. I want to the fact that you brought that up. I get a lot of questions, and you probably do too. Does the product contain soy? And no, the product does not contain soy. Tocopherol is vitamin E, and it's been extracted from soy, but that's not that it contains any form of soy whatsoever. It's strictly vitamin E. And you know, when you look at that label, sometimes people get confused because they see the soy and they don't know what the tocopherols mean, and it's just meaning that they've extracted the vitamin E out. So there's no soy in this product, and that was the other thing, is I wanted to make sure it was a soy-free based product. You know, where is our ingredients? Where are they derived? Where are they from? The United States? A lot of companies put products together, and those ingredients are not here in the United States, so we don't know what lab they've come from or what the quality is of them. And all our products are derived here, and you know, under specific standards in processing, which makes it wonderful when you're relaying it to, especially a patient. You want to make sure that they have the cleanest source and a product that's going to deliver what it says it's going to, and this product definitely has.
What's your projection for Somaderm in your community of healers and alternative docs? Do you feel like it's really going to make a mark?
Yes, very much so. Very much so. I've reached out to numerous other naturopaths, and they've asked me several questions, even though, because I'm using the gel, so they want to know from me, and they've looked at it, and they're very excited about having something that, again, that will definitely benefit the HPA access without having to have our clients/patients swallow pills. It's unfortunate, you know, it's oftentimes we have to have 3 or 4 different things to try to manage a specific set. And it's not that we want to, but again, as you know, Patty, we live in a society where people want to see results and they want to see it quickly. And if they don't see it, they don't come back. They think that you don't know what you're talking about, but, you know, because they're used to the fact that if I take a pill from a doctor for an antibiotic, within, you know, 5 or 7 days, I'm going to feel better. And, you know, we're under that same kind of pressure, and this product is able to deliver in an aspect without having to put our patients on a numerous amount of pills or tablets, and easy application, and getting more benefits than what you would think. You know, so if a person is coming, I'm using it for a thyroid adrenal, they get the benefits of the skin. Who wouldn't want that? Stronger bones. Who wouldn't want that? Who wouldn't want, you know, stronger muscles or better recovery from workouts, which has been a phenomenal thing. My husband and I started CrossFit, and what used to take days for recovery, my husband's a little older than I am, because CrossFit really is harsh. Within hours, I'm ready for the next day, and that never used to be.
It's remarkable. I mean, I don't know. I'm glad I have the gel, because I might be having a hard time sleeping tonight. You got me really excited, but you know, how lucky are we, really? I mean, you know, I'm going to be 55 in June, and so you and I are in that same category where, you know, sometimes you don't think you're going to stumble on something this exciting. And not only the product, right, but this amazing community of optimistic and beautiful people at New You Life. I mean, I've been in the industry for 30 years in networking, and I just couldn't feel any more excited about what's in front of us. I can't feel any more excited about the people that we've yet to touch. And so I want to thank everyone who's been listening. I'm Patty Sinclair. I've been on here with my friend Kenny Olson, and we've been interviewing Dr. Gorgia Balsley from the Michigan team. She's a naturopathic physician for over 30 years and a master herbalist, and we have been so blessed, really, to have you on the call with us tonight, and we will certainly invite you on again.